Hey there, and welcome to the North of Patient podcast, a space where we explore conversations on health beyond care. I'm Paneet, and I'm here to navigate this journey with you. You know, where we're going in healthcare has been on my mind for a while now. I'm a practicing family doc. I've led a digital health startup for over a decade now, and I've spent more time thinking about where AI fits into all this than perhaps I should have. It's a wild time for healthcare around the globe. And honestly, it feels like we're all part of this giant experiment sometimes, doesn't it? But here's the thing, I truly believe in the power of technology to transform how we deliver care, to really elevate the science of medicine. I'm a believer that things can get better, like many of you. But getting to a good outcome isn't something that's going to happen if we're purely focused on the right now, if we keep our sights too narrow and we don't have a good idea of where we're headed. I worry that we might end up with a kind of healthcare that we don't necessarily even want. There are many important and difficult questions we should be asking ourselves right now. Who runs the healthcare systems of the future? Is there such a thing as too much technology? How will the roles of healthcare professionals, such as doctors, nurses, pharmacists, the whole team, really evolve? What part are the humans going to be good at? Any of them? Oh, yeah. And what about us, the patients? How will these changes affect our experiences, our care, and ultimately our lives? To find answers, or at least explore these questions together, we need to think outside the box. And that's why I'm doing this, to reach out beyond the traditional healthcare silos, talk to people who care about healthcare in the future, but perhaps have more degrees of freedom in their thinking and their perspective. Imagine having a chat with a science fiction author who dives deep into societal changes that may happen decades from now, or jamming with a musician who tries to define the human experience as the music industry evolves, or picking the brain of a visionary entrepreneur who builds products of the future today. What nuggets of perspective can these creative minds offer in painting a brighter picture about healthcare a few years down the road? It sounds exciting, right? Well, I definitely think so. And I think the time to have these conversations is now. So if we expand our conversations, raise our gaze, and use our collective imagination, I truly think that we'll do a better job at defining what a good future looks like for healthcare. So North of Patient is for everyone who's part of the healthcare universe, whether you're on the front lines, behind the scenes, or somewhere in between. It's for the caregivers and the care receivers, for the innovators and the dreamers, and especially for you watching this, because we all have an active role to play in making sure we're in control and proud of the healthcare systems we live with. So, what do you say? Ready to explore the future of healthcare with me? Drop your thoughts, questions, or anything you're curious about in the comments below. Without further ado, let's get to it. How does one think deeply about the future?
Yeah, how does one do that? It's a well, I think there's like a couple things in there. There's the why and then there's the how. And the how can be like a very pragmatic thing. Um, so in a pragmatic sense, my own practice has been to answer the how by it's just like it's kind of like instinct. It's like it's something that I realize that I've probably been doing one way or another most of my life, which is I need something grounded. By that, I mean, I need to make it, it needs to feel relatable or tangible in some kind of way. And I knew there were three things that fascinated me that I was like, I think I could probably do one or maybe a couple of those things. One was like an astronaut, be an astronaut. The other was a fighter pilot. I want to fly fast airplanes. And the other was I want or an engineer. Like those are the three things, and they seem to be interconnected in all kinds of different ways. The
Ghostbusters
technology.
never on the list?
Well, it was like adjacent. It's adjacent, because they're kind of like half-assed astronauts in a way.
Yeah, fair enough. Yeah.
And so and it really eluded me until the book did something that was brilliant in a way, is in that it grounded it. So it wasn't the abstraction of high order mathematics. Uh, the point of entry was just it was something simple. It's like is there something like how would you determine the area occupied by a circle? Just like a 2D circle. And it's like, I have no idea. But then it said like you would just add up like all these little rectangles that fit inside of it. I was like, yeah, that's kind of right. And it's like, and if these rectangles got so small that there was no space between them, like at the edges where the arc of the circle is at the edge, then you would get the exact area of the circle. And I was like, yeah, I can see that. Like I could see that. You could draw the picture of it. And so it was taking this kind of abstraction and bringing it down to something that you could really touch in a way. You could, if I could draw it, then it seemed so much more tangible. I think I've carried that forward to say, if we're going to think about something that we can't possibly imagine what it is, let's start by grounding it in something that is relatable, that you can like identify with, that that you know from other kinds of experiences. So it's not an abstract thing, so that it doesn't feel so far out of reach that you think, wrongly in many cases, that only really smart people can really talk about this. I shouldn't mess around. This is not my domain. I'm not smart enough for that. And that experience of, basically when I was in middle school, I was told, you're not smart enough to take the pre-calculus classes. You belong
Mhm.
in this class. And I was like, I don't think that's right. I don't see that. And having good parenting, my parents being like, don't listen to them. They don't know what they're talking about. We'll sort this out. Don't worry about it. And I think those kinds of experiences just made me realize that, um, with the future stuff, not talking about it abstractly and not trying to make it sound like it's a privileged domain for people with advanced degrees, and then bringing it down to this thing, like one of the questions I'll ask, both as a provocation to the point that we're talking about, as well as to kind of get people in the mode of thinking about something in the future. We're talking about like AI. What's the future of AI? It's like everyone ends up, with many people, oftentimes you just end up saying what you've heard someone else who you think is smarter than you has said,
Mhm.
or you think is like, well, they must know what they're doing because they're a billionaire. It's like,
Yeah.
I don't think so. I don't think so. You're
Yeah.
just saying what they're saying because you think they're the leader of the band, but it's like you have every capacity, because of this incredible vascularized piece of meat in our head called a brain, to imagine. And so let's start with asking the question, what's the future of AI, by asking ourselves, I wonder what would be for breakfast in a future in which AI was as normal, ordinary, and everyday, as a frying pan. Like, we don't wonder about the future of the frying pan. Maybe we should.
Yeah.
Interesting project. We wonder about the future of things that we have trouble imagining, and that there's a lot of exuberance around. There's a lot of, hype. There's a lot of confusion. There's a lot of antagonism and anger and anxiety. Let's try to figure out a way in which we just, let's just sit down and have a conversation about it, but imagine it in normal, ordinary, everyday terms that everyone can identify with. Because, to the best of my knowledge, speaking of food, everyone has breakfast or first meal of the day, generally
Mhm.
speaking. Can relate to that, and just start from that and just build, using the imagination to build on that, until we're at the point now where we're having a conversation that is really meaningful and feels like we're actually doing the work of crafting and discussing and describing and prototyping and building the kinds of futures that we would like to inhabit, as opposed to the kind of futures that, I don't know, Elon and his buddies want us to inhabit.
What inspired you to take that approach around that?
I was I was kind of interested, as a kind of film fan, of the stuff in the background. Like, I was interested in, like, what is that stuff behind them? Like, what are they? What is the world that they're in? And it's almost like, if you, especially if you watch a film more than once, you start becoming interested in the mise en scène, I guess, like what's lying around, what is this world that they occupy. And then also, I'm a big Kubrick fan, and early on, my parents had this wonderful book called The Making of Kubrick's 2001. It was like a little paperback, and I remember spending time with it because it had a lot of photos in it. It was a paperback, and then it felt like kind of unusual, back in like the 80s, for just like a pulp paperback to have a bunch of pictures in it. And the pictures were a bunch of like the production design. They were just
Mhm.
like, they zeroed in on some of the elements. So I remember one, it was a close up of the instructions for the zero gravity toilet. that features in the
Hmm.
film. And that, it's a scene that people refer to. It's like, yeah, good point. How do people go to the bathroom in the future, in the gravity-less future? And it's just those little elements that you start to essentially, you see the contours of the world, and it also is that really, basic thing that everyone goes to the bathroom, and it's a thing that's like, it touches you in a way where the first thing is like, you kind of chuckle at it, like, oh yeah, that'd be a problem. How would you do that? And then you start asking yourself the question, how would you do that? And then if you're inclined to start crafting and thinking about and kind of, almost like building that future out, you do things like what Stanley Kubrick and his production design team did, which is like, let's write out the instructions. And it's not going to be Greek text, it's not just going to be like blah 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 blah. It's like actually the instructions. We're going to sit there and we're going to wonder, how would you do that? And we're going to write it out as if everything depended on it, as if that was our job. We're the, second level, occupational safety engineer at Rockwell International. And well, we got the short straw. We're the ones who have to design the zero gravity toilet. Actually,
Yeah.
really fascinating engineering problem. How do we do that? But rather than doing that, let's say as a futures designer, or you're doing this kind of work, to help imagine into the future, don't try to solve the problem. Start by writing the instructions about how the solution would obtain. Like, start from that perspective, not from, the first reaction is, especially if you're like an engineer or inclined in that direction, is like, start talking about like, you know, vacuum systems and kind of like disposal mechanisms or whatever it might be. But just tell, can you explain, forget about the engineering stuff. Can you explain to another human who maybe knows nothing about engineer, they're just a passenger on this spacecraft. They're a musician going to play a gig up on the space station. Now they got to go to the bathroom. Explain to them how to do it. And I think that's actually the harder problem, because, I mean, you deal with any kind of human that could need to go to the bathroom in zero gravity.
Some of the things I think about are how do you challenge some of those norms when you fundamentally don't necessarily even want to emulate some of those things. For example, the idea of the waiting room is people are having to wait in order to be a patient and in order to be seen and to access care.
Trying to channel like, a waiting room experience. So I had my physical a few months ago, and so in the waiting room, it was actually, it was, I don't know, it wasn't that bad. Um, but there are a variety of things that remind you that you're inside a structure, you're inside a system, right? So, everyone I don't know how it is in Canada. Here, you get handed a clipboard with like a stack of forms.
Yep. Yep.
And so you got to going through them, and some of them you just kind of like, I'm just going to sign this, might vaguely, somewhat like hopeful that you're not doing anything that's going to really sign something away that you don't want to sign. You kind of go through that, allergies, other kinds of like really utility kinds of things. And while you're doing it, you're thinking like, man, don't they have this in a record? I've been coming here for ages. You see that
Yeah.
kind of goes into your mind. Um, so it's like almost like I go there. I'm not sure what it would be, but if you're gonna try to imagine into a possible future, I think there's a range of things. Like, we want a more habitable healthcare system. Let's say that's one of the assumptions. We don't want to make anything worse. Um, and we want to think about the ways in which we can make the experience, uh, yeah, I guess more pleasant. What does that mean in healthcare when you're getting like you're going to the proctologist? I don't know what that means, but it's like, you want to make it feel like something has evolved. We've taken this problem seriously, and we've addressed it, and we've made certain adjustments. So, because I think we also want to make it in a way kind of feel believable, I feel like there's something in between the, taking some of those experiences that it's like, okay, this is familiar. I'm going to fill out all these forms. Um, it's not so bad that I'm going to, throw up my hands in disgust and storm out. Just got to go through it. There's a little bit of pain that's involved when you're dealing with a large bureaucracy, and you accept that. And then also I start imagining like, what are the other elements around in that waiting room? that you relate to. Like sometimes some waiting rooms will have like posters up reflecting certain kinds of think habits that they want people to kind of remind say it's good to exercise, make sure that you're getting
Yeah.
your exercise in, those kinds of things, and looking at the ways in which those are slightly maybe tweaked in a way so that they feel like they've come from a slightly adjacent, better healthcare future, or they've come from some kind of future that represents new habits or rituals in a way, something that shows an evolution of what the existing bureaucracy was. It feels like, starts feeling into the kinds of things that we would prefer or want to have in that future. I don't know, for some reason I'm thinking of there was a time when jogging wasn't a thing. No one knew what it was.
Mhm. Yeah.
And so someone had to write a book about it to help people imagine into what it was to jog. You had to like
Mm.
really sell it. It's like it's
Yeah.
good for you, that kind of
Yeah.
thing.
You get special clothes, you get special
Yeah,
shoes for it.
yeah, that's right. And then he's very clever. He started a shoe company called Nike. But the
Yeah.
how do you do that kind of like almost like a Jedi mind trick to show that there was a was, and now this is the now. Things have changed. And the thing that makes us chuckle about that book, the jogging book by Bill Bowerman, is that we're like, I can't believe that people, how could that possibly be? How come jogging wasn't a thing? What was it? And I'm less interested in the, I'm sure there's like a socio-political kind of economic history behind it, or who knows what, why jogging wasn't a thing as now. It's more the point that it's possible to imagine the world otherwise and bring that new kind of world into existence. So what do you need to show people that gives them a sense of that there is a possible other world. There is a possible future in which something has gotten better. The jogging book being, just one of, you can do wheels on luggage, like what took so
Yeah.
long? Come on, the wheel's been around for a
Yeah.
long time, hasn't it?
Yeah. I'm sure that came a lot more recently than we imagined, right?
Yeah, like
Walking with the bicycle or the train.
yeah, it was like I think the patent was like 1991 or something like that when it got patented.
Um,
So people were doing, they were playing around with it, and there were some failures, people trying to sell it, and then there was the early failures where it's just like, oh my God, humans, what's going on? It's like I remember luggage that was like you pulled it the long way, which doesn't make any sense ever because the moment arm is going these two ways. So why do you have the long luggage? I don't know. It's fascinating, just the evolution of these things. But how can you do that? So in any context, healthcare, luggage is just like a kind of, interesting one because everyone can relate to it, but everyone can relate to healthcare. What
mm,
is, you know, if you were to write a book that says like healthcare 2.0, what would it be saying? And how would you represent it? So I'm sure, in your space, people have written probably lots about what we could do to improve healthcare. How are they
yeah.
showing it? Are they showing it in a tangible way, or is it in an abstract kind of more policy way or
Yeah.
economic way that normal humans can't really see themselves in?
I think that represents one of the several challenges healthcare has is there is a sense of the closer you are to being at the front lines and the more immersed you are in kind of the system and the way things are, the more immovable those walls feel, right? Just because you have your own scars, you tried to change how referrals happen. And I have colleagues who spent a considerable amount of time trying to tackle some of these challenges, and you become disheartened and you become disillusioned, and you realize that there's this unchangeable nature that kind of protects a certain element of healthcare. It all started with the do no harm and take no
Yeah.
risk. And now it's become this sort of carapace that makes it completely immune to being able to change even positively.
Yeah.
And part of the reason why I wanted to engage in this endeavor of speaking to folks such as yourself is because I do think that there's a benefit, something to be had in people being able to not be constrained by those same walls, right? And
Right.
to have those degrees of freedom to be able to say, well, that doesn't have to be there. And sure, that's been there for 50 years, but we can do something different. And let's make an assumption that those aren't there. Now, what are we building for? And where's the value and so forth?
It's rare to find the the individual as a collective or groups of people who are able to see into a possible future who aren't going to be immediately daunted by the magnitude of the task, particularly something as arguably intractable as healthcare, because you can think of any number of arguments as to why it's not. You spend a lifetime trying to turn the battleship around or whatever, and suffer the consequences of that, of having the vision of what it could be, and then working hard to bring it about. Which is why it becomes difficult to enact the kind of change that I think many people would desire. But I think imagining into those and trying to see them, trying to envision them and make them tangible is a big part of that step. In other words, trying to, in a way, almost like in your imagination, going into that future and looking around and bringing some stuff back to the present. Just bringing simple artifact back from the present. A prescription bottle. Like, what has changed about the prescription bottle and the label on it, let's say, that indicates that there's been, some kind of change in the world? Like, what does it say that indicates that some aspect of the system has evolved? Or, a note from the doctor, whatever, what are the ways in which you see little signals, clues as to what's happened without trying to answer the whole problem, without trying to fix everything?
Mhm.
What is the advertisement for some new medicine, or some new eh, um, procedure or new kind of cultural ritual that feels like it's come from the world of health and health management and wellness, that indicates, oh, wait, this looks like it could, where is this from? It's like, oh, this must be what they're doing up in Canada. It's like, no, 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 I'm just imagining what it could be, but I'm bringing it to
Mhm.
you in a way that it feels, you connect to it even to the point of asking questions about it. You're not seeing it like seeing something that is, um, maybe wonderfully, but obviously science fictional.
Yeah.
The whatever, every science fiction film that touches on healthcare, there's the machine that you walk into that cures you, your kind of thing.
Yeah.
Um, yeah.
Yeah. It actually reminds me of a quote of yours that I'd written down, but I was reading one of your recent posts, and it said, imagination has to be allowed in and given free range, as it always precedes inspiration, and inspiration always precedes innovation. And this kind of focus on imagination being almost a necessary substrate, I think is, as somebody who's worked in a digital company, I'll help build a company. And I've worked with a number of startups and seen a number of innovation communities. The word imagination doesn't necessarily always come up. Imagination is rarely seen as an important part of that process, and I'm not certainly there's exceptions to that rule, but I think there's something to be said about being able to start with that fiction, as you said first.
Yeah, and that's one of my projects now, is like, try how do you reinvest a utility value, an understood utility value of imagination. In other words, it's not the thing that you stop doing when you're 8 years old and your parents tell you, like, hey, you know what, it's time to something something. Stop playing with crayons. You're too old to play with crayons, aren't you? Um, and remind ourselves that it's this evolutionary advantage that we have to make and remake the world. And how do you do that? You have to be able to sense into that world that you want to remake. And I think that starts with imagination. And I think we fetishize inspiration and innovation. Like,
Yeah.
what an inspired guy. Where did that inspiration come from? It's just, my experience is that it starts with imagination. And I think if we
Yeah.
can gain a new, like a fresh, reinvigorated appreciation of its utility value, then it's almost like you can bring that to work without being feeling ashamed or embarrassed. Like, I love to imagine things. And people say, like, well, how's that going to help us keep our 4% year on year growth? It's like, it's all about it. That's where it starts. It's
Mhm.
it's not that doesn't happen just because we each have an inbox and an outbox and a workstation.
Well, it is very much a primal necessity, right? But do you ever find that this particular moment is almost overwhelming in terms of possibility? We're talking about becoming an interplanetary species. We're talking about blurring the lines between our reality and other realities and existing in multiple realities.
Right.
Knowing all those narratives that are ongoing right now, do you find that it becomes almost more challenging, or how does it impact your ability to coherently think about the future?
I would love to have a practice that was able to create an artifact from, multiple of all these possible futures. That's my practice essentially. It's like I want to imagine into these futures, and not do it in a kind of predictive way, but do it in a way of like, man, I would just love to have like a box of stuff from all these possible worlds in order to open up conversations about what it might be like to be there. And then that conversation is the one where we're not assuming that we're going to be there. What we're trying to do is actually have a little bit more understanding and sense making around these possible futures. Whether it's like, okay, life on Mars. I want a coffee mug from a diner that's on Mars.
I went right to coffee mug. I feel like we're both
Yeah, that's right. The
we're
coffee
both
mug.
coffee drinkers.
Yeah, like so having that as a way to playfully ask questions about it. Um, I mean, not that it matters and it doesn't really necessarily shape the work I'm interested in, but it's like, I'm not quite buying the Mars thing. I'm a little bit kind of like wondering, sounds, I don't know, like maybe someday, but it doesn't feel like as imminent as I think it people want me to feel like it is. That's just me. I
Mhm.
enjoy hanging out in my studio. I'm not into a 417-day trip to Mars
Yeah,
and wondering, it's like, well, when can I go back home kind of thing.
yeah.
Um,
Even if you could wear a VR headset the whole time.
Yeah, I don't know. Um, so my brain just immediately tracks down to that design fiction artifact, the television advertisement, the menu from the diner, the FAQ from the service that you signed up to that said it would be a seamless experience, but you're having trouble figuring something out. Just all
Okay.
those little elements are what I get. That's my way of making sense. That's my way of trying to understand that world. That's the coherence.
So as I'm thinking about this, I'm thinking about the practicalities of the people who are making decisions in the healthcare system, whether it's somebody, the CEO of a hospital, somebody at a payer organization, health insurance organization, care delivery group. They find themselves in very difficult situations, lots of need to be able to deal with the current fire and the financial realities of the next 12 to 24 months. Where does the function of imagination belong in an organization such as that? How
Yeah,
do you create oxygen for that?
it's a really good question. My mind immediately goes to this, what is the equivalent? Yeah, like medieval courts. There was a court jester. There's
Mm.
someone who had the ability to, and the license and the expectation that they are going to make fun of what's going on.
Mhm.
And they're doing that not to antagonize people, although some probably fragile folks within medieval court did feel antagonized, if it's not artfully done and creatively done. But they have this way of being able to show a mirror back on, so they're not the typical kind of yes man, yes sir, whatever you say, I'll do it, despite what I might be feeling or sensing. So they have that kind of they have that license. Comedians do, really good ones do that well. They show the world back to us. I think that's why Dave Chappelle got the Mark Twain Award. He's just like, he shows the world back to you, as hard as it might be for, for some, and as activated as some people might become. What is the equivalent of that in the context you're talking about? I'm not saying necessarily it's like a jester, but what is the equivalent of like, and what's the role? It's like, it's not quite an ombudsman, it's not that. It's maybe more like a different kind of counselor.
Like a futurist counselor.
Yeah, something like that. I think futurist is a kind of loaded term because you kind of come in, it's like, oh, where's your pipe and gray beard? And how come you're not sitting in an Ames chair, lounging about and holding forth? And I think that's
Yeah.
the wrong perspective. It needs to be someone who's like, if it almost, if you start imagining like the something maybe less assuming, where not a lot is expect. It's not like, okay, well, you tell us what you think, Mr. Big Shot. Like none of that kind of stuff. You just be like, I've just been thinking about this, and here's another perspective. Or maybe it's just even like a capability or facility. There's just like a it's a little 2 or 3 person little studio that when something is going on that's indicating a particular direction, or maybe it's just even once a month, they just bring something to the organization.
Mhm.
As humble as that. And, once a month, there's a optional all hands.
So, so I guess to paraphrase, it's more about the function than perhaps the specific role or the dressing of an individual, if you will. But it's more about the room for an activity where somebody has the capacity to be able to inject ideas, concepts into the organization. Is that a fair way to paraphrase it?
Yeah, I think that's a good way. As you're describing them, so I am imagining that thing of just kind of plunking something on the table
Mhm.
and getting people to wonder, like, wait, what is this?
Mhm.
I had this experience when I worked at Nokia. It's like you could show people, like, I was actually just flipping through some old models of a product we were working on and what it could be and how it would feel in the hand and what it might do. And look, there's a new feature there. I wonder what that's for. But there's nothing defined because it's just a 3D print or a machined model of something. No one
Yeah,
has told you what it is, but your imagination turns on because you start willing certain capabilities and capacities. If you just start
yeah,
tweaking little things, and so everything is the same and recognizable, except something's a little different. And so imagining an organization in which you experience those things in one context and you looked at something else that you saw, that you're used to seeing all the time. Matter of fact, you probably ignore it all the time. And you just look and you just do a double take, like, wait, what is this thing? And someone walks by and she's like, have you seen this? Like, what is this poster? Didn't
mhm,
How come something is a little bit different? It's as if you just kind of like tripped for a minute and woke up in a different world.
yeah,
And I think I love that kind of mechanism of like immersing people into a moment without it being super elaborate. It's just something that they have to notice. It's a point of entry. It's like seeing something that you weren't expecting to see and then wondering. So that's something activates in your head. We start asking a question. When you start asking a question, someone else comes behind you and they wonder too. Now you're having a conversation. And I think the
yeah,
conversation is that element like around the story.
yeah,
So we read a story, and if you enjoyed it, yeah, like the first thing you want to do is like next time you see a friend, be like, "Hey, did you read that
yeah,
story? That wonderful short story in the New Yorker?" No, I haven't seen it. Oh, let me tell you about it. Like, why do we do
yeah,
that? We don't do that.
yeah.
It's because you want something, you want to engage people in the world that you felt into, that you saw and that you experienced when you read that story.
Yeah, no, I like that. It's almost as if you're getting people to color outside the lines on purpose, and just to help kind of break those typical neuronal pathways of this always equals that, it always equals that, right? So, how does an organization measure success for this sort of activity? How do we know it's working?
Yeah, phew, that's an important question, and um, I got asked that a week or so ago, and I don't know why I'm hesitating now, but I didn't hesitate then. I kind of shocked myself. I said, like, are people smiling when you engage them in this? Like that for me was like it's the thing that kind of came to me. If we can measure success by the experience that people have at a somatic level, like viscerally, how do they react to this? I think it's the equivalent of imagination precedes inspiration, precedes innovation, where innovation is all the way on the side of like utility value. In other words, it's kind of at the, and that is, in many ways, that's the domain of like the people who want the 5% year on year growth or more, whatever, the kind of rational analytic. And when people say, like, how do you measure the success? My instinct is to is to expect that they want an answer that says like, oh, if you do this 4 times a year, I've got a study that says this will increase employee productivity by 7%. And they'd be like, oh, 7%, I'll take that. If I multiply that by the 10,000 people in my organization, that's real improvement.
Mhm.
And I want to say it's like, I think before that 7% year on year growth or employee satisfaction measurement are people smiling when they're doing what they're doing? because I feel like when people are happier, they're gonna feel more, engaged in the work. They're gonna feel like they are contributing something, that they're producing something of value, and that value isn't that comes back to them isn't just the paycheck. It's a sense of like satisfaction in what they've contributed. It might be just like a little thing and a little part of an organization, much larger organization in the world. But if it starts with this, with the okay, I feel I know, I feel like this feels right. I feel like this is a worthy use of the vast majority of my time, my waking life is happening right here.
I I feel like that would resonate with a lot of people right now in healthcare. You might be aware, but there's a lot of people who aren't very happy with their day-to-day work in healthcare,
Mm,
um, and that contributes to burnout, poor mental health outcomes, high suicidality rates amongst physicians right now. And this is particularly true in primary care and family medicine, which is
mm,
a type of medicine I still practice, where people feel unappreciated. They feel disillusioned in terms of the fact that are we really doing anything beyond sort of completing forms and stamping things for the system? We feel so removed from the actual helping of people. And then people in turn perceive that as a system that's not working and providers that don't care and lack of access and so forth. So it becomes this vicious cycle and snowball that we find ourselves in. And I think the opportunity to inject hope, inject optimism, inject some degree of happiness and meaning is very, very much needed right now in primary care.
yeah. As you're talking, it sort of makes me think. I just wonder, like the kinds of practices that we started talking about. How can that be integrated? Like, like who and or what group of people are going to start imagining into these futures? Doing the speculative design or design fiction around it, but doing it in a light way. By that I mean, closer to the not the tormenting court jester, but the one who's like, I think there could be a better way. And this is kind of some of the things that I'm kind of looking at, that they could be looking at, that are not meant to be meant to feel like the the systems that they're in have evolved, that are, and at the same time, as painful as it is, doing like it in a playful way. And the reason I emphasize that is because I think that no one ever got anywhere by antagonizing someone. I want to help you change, but the you being the system. And I know it's probably like a fruitless endeavor, but I still believe in it. I believe in what we are here for. I believe in what you say you stand for. Let's work together to
Mhm.
try to imagine how things could evolve. And you can very easily, you can come up with all these reasons why you wouldn't even go there, just being like, they're never going to change. They're never going to change. And if you're stuck there, then you are helpless. You have to,
Yeah.
at some level, like believe that there's a possibility for change. And it could just be a little thing, just be a little tweak. There's now one less form. Okay, that's a win.
Yeah.
There's a inspired, imaginative physician starts playing around with AI and figures out a system. It's like, hey man, you know what? I was playing around with this thing, and I think I just eliminated about like 3/4 of the forms I need to fill out. Because we all know they're just these routine things, but we still have to do them. And I don't know anyone else want, and then they've really got that level from like imagination to inspiration, and now they're innovative.
Yeah.
They've changed something, and there will be all kinds of challenges with that. The wheels on luggage thing took a very long time. Then put the wheels on the luggage, but it got there. And it was that
Mhm.
inspired individual who was like, I'm going to push through all the challenges, getting a patent, doing prototypes, convincing people that we can sell these things. I mean, there were a bunch of people who did that and they weren't able to get to the next level, but
Yeah.
you got to keep pushing. That's what we do. I mean, that's the imagination is our evolutionary advantage. It doesn't happen unless you're willing to almost like have the audacity to imagine that change could happen.
There are so many solutions that are currently brewing, that are currently in stages of innovation, that are being deployed, that are being tested, that are finding some place in the system. And I find one of the challenges, one of the complicated parts of healthcare is that fragmented feeling of the future,
Mm,
where You're finding innovation of sorts taking place, whether it's colleagues creating meaningful startups that are able to get legs and solve some problems. But there's so many moving pieces to the system, and there's so many different players that it just seems to, even the solutioning itself at times can seem to create even more of an overwhelming environment. And you're saying, okay, well, each of those things is better, but where is this converging
Right.
into a meaningful and palpable experience for a human being? One last question I wanted to ask you, and this is a bit of an open one, but what are your biggest sources of inspiration? You mentioned film, but what would you say is your kind of go-to place where you come back feeling richer in the mind as a result of it?
It's a near future laboratory. It's like the community that has built and developed over the last. I mean, I think there were a lot of people who were kind of like relatively who were, oh, near future laboratory, it's cool, but I can't find my way into it. And when a few years ago during the pandemic, I started kind of opening it up, not really sure exactly what I was doing, but inviting people in through doing more kind of like, so you could call them like public engagement kinds of things, like doing, well, I mean, the podcast was one that's obviously just kind of mostly one way, but then doing these different kinds of seminars where I invited people in to participate in doing kinds of futuring exercises. So general seminar was one, and I did something called super seminar and those kinds of things. And then the Discord community, I felt like it kind of, in thinking about it now, it kind of felt like when I started the cyber cafe. So I started the cyber cafe in Fort Greene in Brooklyn, 96 maybe or something like that, 97, when it was a kind of a big deal to even get like internet kind of pulled into a building. Like it was a whole ordeal with
Mhm.
um whoever was the wireless company there at the time. Or so not it wasn't wireless. Definitely wasn't wireless. It's like
Yeah.
pulling
The
wire
wire
in. It was
coverage. Yeah.
Yeah, it was like a whole ordeal. I think what I was drawn to was just the possibility of bringing this new thing, forget that it was the internet, this new thing to a community that was, it wasn't like impoverished, but it wasn't the first place you think about when you think about the internet. Like Fort Greene, Brooklyn, beautiful community. I mean, it's done nothing but thrive over the decades. When I was there, it was just like it felt like opportunity and possibility here because you could get space. It's pretty easy. But I just love that idea of providing a point of entry and like a resource, a place. As much as I don't always like I got to do this event. It's like, oh, what a pain in the butt. But it ends up just invigorating me. It just makes me feel excited and vibrant, and I feel like it's just something derived from being like in service to a community of people who are like looking for something or seeking something or want a sense of community. And so that has really been it's a great source. Like I guess I'm supposed to, but also I enjoy spending time in there in the Discord. So it's I look at it's like a gem, humble kind of social club where everyone in there is looking for something and they enjoy the kind of fruits of collaboration and community and conversation. So we do office hours. I love those every Friday. I think I've only missed
Mhm.
one in this Friday will be week 203. So 203 straight weeks of just meeting, spending anywhere from like 90 minutes to sometimes 3 hours just in community, just kind of in and around the kinds of things that we're talking about. People who are really wondering about how do we imagine other possible worlds? How do we materialize them? How do we, do that kind of collectively and collaboratively and in a kind of coordinated fashion. So the actual questions we're interested in, but then just this practice of like, I call it design fiction, we might just call it like imagination. And it's hard to call it imagination because people might dismiss it right now too quickly, but you get what I mean? Like, how do you get there? So that's really my main source of inspiration.
Julian, I really appreciate that, and I will make sure that link is available to listeners as well for people who want
Cool.
to get more information. But again, thank you so much
My
for
pleasure.
the generosity and your time in this conversation. Like, I can't wait to be able to get it up and to be able to take it from here.
Yeah, I'm excited for you. I'm excited for this new endeavor of yours. This is going to be awesome. Digging it.